Hello. Okay, so this is episode 2 of answering questions from submitted questions from Instagram. Um, this one's going to be a little harder for me because they're archived already. Archived. So I might have to go back and forth inside of it. Feel free to ask questions if you join me live, and let's get started. So, 7-month-old thumb sucking habit when sleepy. Should I introduce the pacifier? And they started the oral guide too. Let's do a disclaimer first. So, let's get out of here. Good morning, everyone. Well, at least the ones that are in my time zone. I'm answering the second half of the post questions. I'm on my YouTube live, so it'll be there if you want to listen to all of the answers later. Disclaimer: I am a speech pathologist, but I am not your speech pathologist, and I have not assessed your child. These things are just things to consider, recommendations, things to look at, general thoughts. I kind of push outside of the box a little bit than what is typically talked about and given. So these are my own opinions, things that I have worked with the clients that I work with, and what I believe to be appropriate. So let's get started. Everyone sort of has like different ideas and thoughts, and it can be so much for parents like to walk through and sort out. It's like they're having to almost become a therapist themselves. I know how frustrating that can be. But sometimes what is always done is not the best way. And I think we can all agree to that, right? Like there's lots of things that have changed. Um, and people are like, why did we ever do that the way we did it before? Um, so if what you're doing with your current therapist is not working, then I am a huge advocate of trying something new. All right, let's get started. Now I have to go back into my archives. Why do I want to say chives? All right. So 7-month-old thumb sucking habit. When sleepy, should I introduce the pacifier? And they started the oral play guide. This is such an interesting question. And this is what I'm going to say about it. I want to know why they need the thumb. Why is the tongue not going where it needs to go? So you started the oral guide, so you know that there's some deficit there. I would try to do as much oral play, use vibration, get under the tongue, do clicking with them. You'd be surprised how much babies can imitate when you're in their face and you're doing things with them. And see if you can get the mouth closed during the day. And you didn't talk about if he's a mouth breather or not, so I'm not really sure. If you can't figure it out, I always prefer a pacifier over a finger or a thumb. And so that's a huge kind of a not popular opinion. And so I kind of want to expand on that. So let's post it, and we're going to talk a little bit more about that because there's just more to it. there's just so much more to this question. Yes, I prefer the pacifier over a finger or a thumb because when we get to an age where we can start talking to them about these things, it is easier to remove a pacifier than to remove a finger or a thumb. That is a fact. Um, but the bigger question is why, and why at 3 4 months did we not transition to that posture where we don't need an additional thing to use to calm us. But also, even if you find the functional deficit, there's also the behavioral piece of having a habit at this point. And a lot of people just forget that. It's like they think, oh, you fix the functional deficit, well, then everything should go away. Habits are there because that's what it's a habit. And those are not so easy to just like stop. Also, it may not be that easy to just switch. Okay. I am pumping 3 ounces. All right. I am pumping 3 ounces at a feeding for my 14-week-old. Is that enough? He's only gaining about a pound a month. So, we should be talking to your pediatrician to look at the weight piece. Also, though, um, I'm not a lactation consultant, but I do know lots of them. I work with lots of them. And I think that they would agree that what you pump is not always equivalent to what baby intakes. So that a weighted feed would be a better representation of what baby's intaking. Also knowing that feeds vary. So what they take in one may not be the same as what they take in another. So I would work with a lactation consultant in your area if you have one. Um, but if you're more comfortable, like you're pumping 3 ounces, is he taking that in a bottle? So maybe I'm reading that question wrong. And 1 pound a month, he's only 14 weeks. So I'm pretty sure that everyone would agree that that's not enough weight. 3-week-old tongue tie released last week, still lots of spit up, especially in the morning. What to do besides oral play? So, what's interesting about this specific question is because it's especially in the morning. So, I would look at body tension. What is what are they doing in the morning? Are you still swaddling? And so maybe we need to unswaddle in the morning and open up the body. Um, uh, it's the oral play is great. Make sure if you have my guide, make sure you're going into the videos for under the tongue use and looking at those specifically to make sure we're getting that under posterior tension release. But the guppy is a great way. You unswaddle and then you just like allow them to stretch. And I see a lot of times babies will go into that extension and parents will grab them and pull them back in. Let them open up and relax and release all of that tension from that they've been holding on to. And they may still be having spit up like throughout the day. So we're going to talk about that. Other things that go into play here is the bottle or the feeding. I don't know if they're breast or bottle fed, but what does the feeding look like itself? What does position look like? How is latch? Has that improved any? Where the under the use is extremely beneficial for that. I recommend doing those right before you latch onto bottle or breast, whichever one you're doing. So we have to look at the whole picture. It's not just like the release itself. It's everything else that the baby had been doing for those weeks or days up until the release that developed their motor plans, we need to relearn and change the muscle plan, change the motor plans. It's muscle education, re-education, however you want to look at it. All right. Let's keep going. OT sees a posterior tie. ENT says not a real issue. 7-month-old nurses well, but mouth breathes, confused. So the OT may be looking more from a functional perspective. The ENT may be looking at just a visual representation of what it looks like. And we all know that function matters when we're assessing oral restrictions, right? She nurses well. That sometimes it has more to do with mom and an oversupply than the nursing itself. So at 7-month-old who mouth breathes, why are they mouth breathing? Is their tongue hanging low in the mouth? Are they a little floppy? Do we have some low tone? There's things to look at and consider, but also how are they doing with table foods? Are they moving the food side to side in their mouth? Do you see good movement, or do they keep the food in the center and just swallow it? That's a good indicator of what you're looking at in terms of function. This is where like providers focus on different things, right? Some providers are looking, well, most providers don't look at the whole picture. They're looking at one specific area. It can be extremely frustrating for you as a parent when they have so many differing opinions. 4-month-old checked for tongue tie, seen 2 osteopaths and improvement in movement, but not in reflux. Here we go. So I would look at the feeding itself. How does the feeding look? What is position? But also, when is the reflux occurring? Is it immediately after a feed? Are we overfeeding? Are we burping too harshly? Are we removing baby from the feed to burp and that's causing a disruption? So, or is it an hour or so after the feed where they're refluxing? Then are we having some sort of intolerance to what they're digesting? There's lots of things to look at when you're looking at reflux from a functional standpoint. Yes, I talk a lot about reflux means you're getting in air, but a tongue tie is not the only way you can be getting in air. And I do one-on-one consults. So that is always an option if you need it. So we're going to link that for them here. Let's see. Copy. I'm going to paste that link. All the links for my YouTube people are on the homepage. If you need it. I'm sorry if I'm shaking you guys. Okay. And let's keep going. 4-month-old refuses the pacifier but sucks on fingers to soothe. How to deter this habit? So sometimes if the palate is shaped like a finger, the pacifier just doesn't sit in that space enough to stimulate for comfort. I have a finger sucker. My youngest is a finger sucker, and I tried my dangest to get her on the pacifier. She has a high palate. She was a NICU baby. And we're working through all of those things, but she would not leave her finger. And she's a single finger sucker, which means her palate stayed this size and this shape. It is really hard. It is not as simple as you don't let them. Um, because they need that in the beginning, but then that turns into a habit. I think people don't understand that habits are really hard to break and it takes time and effort. So I would try to focus on a pacifier that So I would try to focus on a pacifier that sort of can fit into her palette shape. So like I love the Ninny because it is so flexible that it molds and the tongue can really it can change the shape of the pacifier. Um, but if she's a finger sucker, she may have a really narrow space, and so the soothing may fit in that space a little better. And then you can sort of transition to other pacifiers as she starts to accept it. Also, don't give it to her while she's angry or needs something to soothe, or she's like wanting that habit. So always give it. It's similar to when you're trying to do bottle for bottle refusal. Give it to her so she gets used to the texture and the taste and develops a relationship with it, and that may help. Or you do all the things you can do until she's cognitively ready to sit down and stop the finger sucking. Because again, it's not that easy to um stop digit sucking in an infant. um Especially when you put them down to sleep and they like use their like would you're just going to sit there all night and take the finger or thumb out. How to move schedule from play eat sleep to eat play sleep. How to move the schedule from play, eat, and sleep to eat, play, sleep to reduce dream feeds. So I want to make sure that a dream feed is that they are sleeping, they are not fully awake, and you give them a breast or bottle to supplement. If they are eating and falling asleep, that is a little different. Now, if you don't want that, then you have to move it slowly away. So um, you can either start by feeding, and then when they fall asleep, you remove the bottle, you wake them, and try to put them down asleep a different way. It really depends on how old they are they nursing, or is it a bottle? But if you're wanting this, then you have to wake them when they start to fall asleep, because you have to get rid of that association first and then like slowly transition back. So if you're feeding, I'm gonna wait for it to post and then I can go back in. Done. We're gonna go that one again. So if you're feeding and they start to fall asleep, I would remove the breast or bottle. Um, Maybe change positions, have them awake. I mean, before you start the feed, get them naked. You don't want them in a dark room with a sound machine on, rocking them. And maybe that's where you start. You slowly transition off all of those associations, and then you just sort of build away from that. So then you give them 2 minutes of playtime before you put them down, and then 5 minutes, and then 15 minutes, and then you slowly transition out of it. You can change your routine however you want and what fits best with your family. Just make it gradual, because it's not always a schedule. I think people get hung up on you should feed your baby on demand and it shouldn't be a schedule. It's not necessarily a schedule, but a routine that babies get into. All human beings sort of follow a routine, and kids need routine in their life. Best post tongue release activities. The best ones to do are all in my guide. My favorite one, and the one I think you can get the most out of, is the Under You, which is in the guide. But also, like, these activities should be done before and then after, and then like oral play is, I we move our mouths, we chew hard foods. Babies don't get those experiences. And even now, like, lots of people have tension in their jaw and their shoulders, and it's because we don't do enough. We're eating processed foods. We're not doing enough for our muscles in our mouth. And so oral play can continue for however long you want it to. My 6-year-old still does them, and when he's carrying tension, when his shoulders start to get high, we do them. And so for post tongue tie, it's all in the guide, but you should continue them. People are really angry about this idea of oral play. And it just blows my mind that us as adults, we do so much for us and our pain, and or maybe we ignore it and we live in pain, but we don't address it for our babies. Their muscles and their bodies are working the same way. They carry tension just like we do. Did your business blow up here? I can't remember how many followers you had in 2020. In 2020, that was what year are we in? 2022. I mean, I don't know. I probably had like 3,000 in 2020. My business has grown on here for sure. But it has been a slow growth in terms of how other um, brands tend to grow. But I love that. I think that the people who are following me need the information, appreciate the information, and I'm getting like repeat cases where they're starting to have another baby and they know I'm here from the beginning, and they can see such big differences from their first. And so it has definitely grown, and I'm really proud of that. And I thank all of you guys for sharing me. I wouldn't be here if it wasn't for you sharing my work. Um, yeah, slow process, but I have loved it. So we are going to set this. And next question. 3-month-old sleeps with mouth shut, but mouth is opened when awake. Need to address how? I think I answered something like that yesterday. So let's see. I don't want to run out of time. 2-month-old with reflux and tongue tie, doing your oral play guide, how to tell if it's enough versus a tie clipping. This is a great question because it has to do with so much more because of the plans that were given. So let's say that you don't have access to a therapist. Okay. I do virtual one-on-ones. I know other people who do. You need to look at the whole picture. So the oral play guide is great because it's getting the mouth moving and those muscles moving and working differently than they were before. How long have you been doing it? What else in the body needs to be released? Because remember, the tongue's connected all the way to the toes. So we may be doing and releasing tension here, but are we also doing the guppy? Is baby comfortable in the guppy? Because if they're not comfortable in the guppy yet, then we know that they're carrying tension. And so we need to work on those things, but also feeding itself, position, how you're feeding, etc. Like, all of that matters. It's a whole relationship. It's not one entity. And so the oral play guide helps bridge that gap. But we need to be looking at everything else as well. My 2-year-old constantly coughs and chokes when drinking out of all cups. Any suggestions? This is an interesting one for me. At 2 years old, I would expect that they have become more efficient in their cup drinking, but you're saying drinking out of all cups. And I'm assuming that you've been trying for a while, like, right? They're 2 years old. I would go for a feeding assessment because I'm curious as to what's the tongue doing, but also what's he do with foods? Like, what does he do with a puree? Does he cough on that? Does he cough on his saliva? Does he have a history of respiratory illnesses? Because that can indicate something up with the mechanism, like dysphagia related. But could also be related to the vagus nerve. Vagus nerve can increase coughing, that sort of response. And so, how are behaviors? Are they hyper? Are they hard to like? Do they get overly emotional? Things like that. Let's look at vagus nerve. It's never a bad thing to get an assessment from somebody. Like, you can't ever go wrong with that. All right, perfect timing. Let me add that. Yeah. All right, you guys. I think that's all of them. So I know there was some questions. Good morning, everyone. Now you can hear me talking on my Instagram. All right, that's it. This will be saved and posted, and anything that you need from me will be linked in the bio. So feel free to jump on it, and I will talk to you guys later. Let me look real quick. Oh yeah, there we go. All right.